It's really important not to clean both of them at the same time, because if you clean one of the teeth and then you go right away to the second tooth, there's a papilla in between, a little piece of gum, and you're going to cut that gum. And then you're going to have sort of like a black spot between because there's no gum. So it's not going to look nice. So that's why it's important to clean one side, as you can see over here. Clean one tooth, then you come out, and then you clean the second tooth. So if anyone doesn't understand, I could demonstrate it more. Okay. إذا نسوي كأنما هذا السن. اوكي. فالسن هيك يطلع، واكو سن ثاني هم يجي هنا. اوكي. اثنين بصف بعض. فلما هنا اثنين بصف بعض، لما تاخذون الخيط وتدخلوه، لازم اول مره تدخلوه هنا تنظفون هذا السن، وبعدين تطلعوه، وبعدين تدخلوه وتنظفون السن الثاني. ما يصير تدخلوه رأسا تجروا من هنا وتنظفون السن الثاني. ليش؟ لانه اكو لثه هنا بيناتن، واذا رأسا تدخلين هنا وتخليه على السن الثاني راح يقص اللثه بيناتن. فراح بين الاسنان تشوفون اكو هاي شويه اللثه تجي راح تنقطع وراح تظل مو حلوه يعني بين الاسنان.
Are you supposed to apply pressure downwards on the gum?
No, very important. Good question. هذا شيء كلش مهم، انه عقيل كان يسأل انه لازم هل لازم ندفع جوا على اللثة لما ننظف؟ لازم لما تدخلون تنظفون لازم وين هنا تدخلون بس توصلون يم اللثة توقفون. اوكي، ما يصير تدخلون كلش داخل لهنا.
ليش؟ وإذا يتجمع فيها؟
لأنه إذا تدخلون كلش جوا هنا راح اللثة راح مثل راح تعورون اللثة، فويا الوقت اللثة هي راح تنزل. فهذا شيء مو زين، لأنه لما ينزل هم نفس الشيء يصير، أنه السن راح يظل بس اللثة راح تنزل وراح يصير مثل أكو فراغ بين الأسنان، وعادة مو حلو.
يتجمع هو بداخلها قاعد يتجمع في هذا انت قاعد تطلعها.
إيه هو عادة إذا يتجمع هنا رأسا وين اللثة توصل يتجمع هنا. فلما تدخلين شوي يعني اللثة لأنه أكو وصلة من اللثة اللي هي يعني هيك طالعة على الهواء، وأكو وصلة من اللثة اللي هي ملزوقة على السن. فهي إذا تدخلوها هي بها 1 ملم اللي تقدرون تدخلوها داخل اللثة، بس أكثر من 1 ملم مو زين. Did that answer your question? So, there's also another problem, which is malpositioned teeth, and that has to do with braces and orthodontics, which is the field that I'm interested in. This kind of treatment takes a long time, it takes many years, and it's also pretty expensive. But as you can see, the results are usually very, very good. I mean, a person with teeth like that, you can appreciate that it's very, very difficult for them to keep their teeth clean because food just gets stuck all over. While this side, although her gums don't look too healthy, it's a lot easier to clean. فاللي كنت قاعد اقول انه اكو هم مشكله ثانيه، انه اذا واحد عنده اسنان مو عدله راح يلاقون هواي صعوبه انه ينظفون الاسنان، لانه اذا تشوفون هنا الاسنان مثل واحد فوق الثاني، وهواي اكل راح يتجمع بين الاسنان، بينما لما الاسنان هيك كلها عدله هواي اسهل انه واحد ينظف الاسنان. بس على مود نعدل الاسنان منا لهنا لازم واحد يحتاج تقويم. شكرا. I'm going to talk a little bit about whitening because I know that's what everyone's interested in.
بس عندي قبل ما تتحول لهذا الموضوع، اللثة إذا واحد عنده لثة توجع،
إيه
شنو السبب؟
ممكن هواي أسباب. أكثر شيء اللي أشوف أنه لما أكو فراغ مثلا أكو أسنان اثنين وما مو ملزوقات مع بعض. اوكي، فاذا اكو فراغ بين الاسنان لما واحد ياكل الأكل لما نسد الأسنان ندفع بقوة كلش قوية بين الأسنان، فعادة الأسنان لما ملزوقة الأكل رأسا يروح على الجهات، فمثلا يجي على اللسان أو يروح على الخد. بس إذا أكو مجال بين الأسنان، يعني الأسنان ما لازقات مع بعض، أكو مجال هواية، ممكن يروح رأسا على اللثة، فلما ناكل واكو مجال رأسا يروح على اللثة يقوم يعور. فهاي وحدة من الأسباب، بس أكو هواي أكثر أسباب، بس هاي أكثر شيء نشوف. فتعتمد
هاي يحتاج تنظيف رأسا،
يحتاج تنظيف، وممكن يعني اكو حلول، اكو هواي حلول. اكو ممكن يخلون مثل حشوة، يعني يخلون السن مو هنا، يخلون حشوة شوية أكبر من لازم على مود يسد الفراغ بين الأسنان. أو ممكن شيء إنه يخلون هو هذا التقويم ويركون السن، يخلوه لازق ويا السن الثاني، وبعدين ما راح يكون مشكلة. I'm going to talk a little bit about whitening. So there's a lot of things on the market in terms of whitening, and I'm sort of going to try and explain what they all are and the differences between them, so you sort of have an understanding of them. Now, even I don't have an understanding of everything, because there's always new things coming out on the market, and I don't know all the chemicals, I don't know everything, because it's too much. But they're all composed of the same thing. So there are two basic types. There's one that's sort of like a surface cleaner, and then there's a whitener. A surface cleaner is something that you have staining on top of your tooth, and what it does, it's a little abrasive, and it cleans the tooth from the outside. Okay, so these are the examples that usually, let's say the gum over there, and the toothpaste. Okay, usually they're a little more abrasive, and they clean your teeth that way. So when you're brushing with your teeth, it removes all the stains in front. Okay, then you have the chemical ones, which is all the rest, and those ones work on a peroxide. So they all have different formulations, but basically it's the same thing. It's a peroxide, and that goes inside the tooth. And what it does is, let's say there's a stain that causes a discoloration in your tooth. It breaks that stain in half, and then it breaks it again, so that when light goes into your tooth, it refracts in a certain way that it looks lighter, so you don't see the stains. Because obviously, if I have this computer, I can't see through it. But if I break it in a million pieces, I could see through it. This follows the same concept. So it doesn't remove the stains, but it makes the stains invisible. So which one should you go for? There's many different things. There's the zoom that everyone advertised so heavily with as you can see, the laser light over there. There's the ones that you use at home, like the Crest and the Listerine. There's the mouthwash. There's the one over here that dentists use in the clinic. There's this one that you can use at home, but also given by a dentist. So which one do you use? What's the difference between them? Essentially, the difference is concentration. So, first of all, for the zoom, it's been shown to be just a gimmick. So the laser has nothing to do with whitening your teeth. They do it just because people like lasers, and when people see, oh, this is with a laser, it must be something different, it must be better. But essentially what they're doing is, they take the same chemical, and they put it on your teeth, and then they shine a laser on it. But it's the chemical that's doing all the work, and the laser isn't doing anything. I'm exaggerating a little bit. The laser is doing a little bit, but what the laser does, it activates the chemical. So essentially, it's the chemical doing everything. In terms, and they're not allowed to use as high a concentration as in the dental clinics, because they're not certified to do it. The ones that you can take home, like over here, they make little trays for your teeth. So it contours your teeth, and then you put a little gel on top, and it's pretty concentrated because it's given by a dentist, and then you place it on your teeth for a few minutes a day, and then you take it off, and your teeth get whiter, significantly whiter. The last one is you go to the dentist and you sit down and it's a one-time thing. They put it on your teeth, you wait for a few minutes and then you leave and your teeth get whiter every time they use it. But obviously the concentration for this one is the greatest. And these ones, the ones that you use at home, are the least concentration. So which one should you go for? Well, it depends on a lot of things. First of all, it's not for everyone. If you have fillings in your front teeth, it's not for you, because your fillings are hidden on your teeth because they're the same color as your tooth. If you whiten your teeth and you have a filling, then your filling is going to show more. So when you smile, people can see, oh, he has a filling between his teeth. Also, there are different types of stains that it can remove and different types of stains that it's better for. So stains such as coffee stains, smoking stains, those kind of things, it's very good for. Other stains like congenital stains, it's not as good for. Which means stains you're born with. What I suggest usually when people ask is to start off with the lower concentration ones. If they can achieve a level of whitening that they like with the lesser concentrated ones, because different people react differently, if they can, then go for that one. Use that one and then you're done. You don't need to pay for more expensive ones. If after using those you still don't like it, then you should go for higher concentrations. Then it would make sense. And that's basically it. In terms of side effects that are known are if it goes onto your gums, it could irritate your gums, and it could also give sensitivity to your teeth. So that's about it. Yeah. ايه صحيح ممكن تصير مو ويا كل واحد بس شايفين انه نسبة من الناس انه ورا ما يسوون وايتنينج لاسنانهم يصير اسنانهم يصير شوية اكثر حساسة. فهاي فرق شيء انه قبل ما تسوون هذين الوايتنينج you have to think about it. لازم تفكرون بيها وتشوفون if it's worth it. فهاي ليش احنا ما نشجع كل واحد انه يحاولون يبيضون اسنانهم مش قد ما يقدرون، لانه اكو there's drawbacks، اكو اشياء انه مو زين بيها. اوكي بس اكو ناس ما عندهم مانع يقولون حتى لو عندي حساسيه مهم انه يعني شكلي حلو واسناني حلوه. فهذول الناس نقول لهم يعني تقدرون تسوون شو ما تريدون. فحكيت شوية عن هذا الوايتنينج انه يبيضون الاسنان، وحكيت عن الفرق بيناتهم، وقلت انه العلج والمعجون الاسنان اكثر شيء هذني ينظفن السن من برا، وشي يسوون يخلون فرد شيء ما اعرف شلون اقوله بالعربي بس شلون نقول abrasive، يحك مثل يحك الاسنان، ولما يحك الاسنان يوخر كل هذني الاشياء اللي على السن على مود ينظفها. فاكثر شيء هذني فيزيكال، مو فرد شيء كيميائيه، بس بالحك يوخر. البقيه فرد شيء كيميائيه، انه يخلون ماده اللي هي الباروكسايد تروح داخل السن ومثل توخر تنظف الستينز داخل السن. فاكو هوايد اشياء يعني ممكن واحد يختار اي وحده من هذني، والفرق بيناتهم انه اكثر شيء هي الكونسنتريشن، مثل نسبه الباروكسايد اللي داخلها. فاكيد هذني اثنين الطبيب الاسنان يستعملهن، فالنسبه راح تكون اعلى لانه طبيب الاسنان راح يعرف شلون يستعملهن. هذني يستعملوهن بالبيت، فنسبه الباروكسايد راح تكون اقل. فاحنا عادة شنو نقول للناس؟ انه يبدون ويا الاقل ويشوفون اذا اسنانهم تصير بيضة ويحبون بياض اسنانهم يوقفون ويا هذني الاشياء اللي نسبة قليلة، واذا ما يحبون بياضهن يردون اكثر بياض يرحون ويا هذني بيه النسبة اعلى. So the gold standard is everyone wants a wider smile and go from the top one to the bottom one.